doing hair transplant surgery, only one thing must be keep in mind, because every patient coming in your office is having different facial features and scalp features as well. That is embarrassment for him and for the surgeon who has done this procedure. Then everyone will ask him from. Hi guys, we are here to discuss hairline designs, and while we are discussing hairline designs, we need to discuss many things. Creating a temple, creating a frontal hairline, widow's peak, going it to natural, creating a mounds on the hairline, and these are the basic points in creating a natural looking hairline. And keep in mind, while doing hair transplant surgery, only one thing must be keep in mind in priority, and that is natural looking hairline. And it is not like the same in everybody, because every patient coming in your office is having different facial features and scalp features as well. You need to create hairline according to his facial features. You need to be careful about that. You cannot create the same line in everybody coming to your office. So the doctor doing hair transplant surgery should be smart enough, should be having aesthetic sense in creating natural looking hairlines, because you need to produce natural looks. That is signature of the hair surgeon who is doing hair transplant surgery. Once your patient has a natural hairline, and he will be sitting in a meeting of 20 people, and nobody is noticing his hair transplant, his confidence goes up. And once he is noticed while sitting in a public and everybody asks him, have you done hair transplant surgery? That makes no sense. That is embarrassment. That is not a surgery. That is embarrassment for him and for the surgeon who has done this procedure. Then everyone will ask him, from where have you done this hair transplant surgery, which is ugly looking and which is especially noticeable to everyone. So for the people and for awareness of yourself, I would advise you to go to the aesthetically top people who they know how to create a natural hairline in any patient coming to his office with any kind of baldness, because it depends on the baldness as well. If the patient is coming with a big bald areas, then every planning of drying hairline changes relatively to the patient who is having grade 2 or grade 3 bald. And the surgeon knows how to manage big bald areas, and he should be smartly knowing aesthetic sense of the public and aesthetic sense of himself to create natural hairline. So this is very, very important to draw a natural hairline. We will technically discuss while going to the operation theatre how to draw a natural hairline. Thank you very much, and keep watching these videos and keep sharing these videos, because these videos are based only on awareness. And point is, when you will be sharing these to the public, and public will get aware of these things, so they will be choosing the best for themselves. Thank you very much.